When we look at your X-rays, there are 7 bones in our neck. C1 is like a ring. C2 looks like your fingertip. This is C3. This is C4, C5, C6, and C7. And what you see here is 3, 4 is what I would consider to be normal. 4, 5, first of all, you can see how this one is sliding forward a little bit. See how this one's a little bit more forward than these other ones? So you're starting to develop a little bit of what we call instability, which basically means the bones are starting to slip and slide a little bit. But then also here at 5, 6, and 6, 7, really significant degenerative disc disease at those 3 levels. On your MRI scan, this is a side view here. This is your brain stem that then turns into your spinal cord. C1 is like a ring, which you can't see very well. Here's C2, here's C3, normal. But then we get to 4, 5, 5, 6, and 6, 7, and these 3 levels are wearing out on you. And also, as the discs collapse down, it's going to cause pinching of the nerves, and that can give you arm symptoms as well. This is a view here on the right-hand side, looking at you from your feet upwards. So this becomes the right side, this becomes the left side. That's your spinal cord, and these are the actual nerves coming off the spinal cord. That's what I would consider to be a normal level, and that's at 2, 3. We go down to 3, 4, and 3, 4 also looks pretty normal. We pop down to 4, 5, and you can see that it starts to get a little compressed. It's a little bit more concentric there at 4, 5. And then we go to 5, 6, which is even worse, and 6, 7, which is not as bad. But so basically what you have is you have 3 levels of cervical disc disease with instability and pressure: 4, 5, 5, 6, and 6, 7. The good news is you do have a fair amount of room around your spinal cord. So please hear that you don't have to have surgery if you don't want to. You don't have to have emergency surgery, but what drives people is just your quality of life and pain. It looks like it hurts just looking at you and your motion. And so surgery would make you better. The pros and cons of the surgery, obviously, is the goal is to get you out of pain. Get the pressure off the nerves, and any arm symptoms you have should be gone when you wake up. Your neck pain is a secondary gain. It will get better. It just takes a little while to recover from surgery. The way that we do it, and there's kind of 2 different options, and so let's talk about it. You have diabetes, correct? Okay.
Yes.
So I'll tell you kind of my rationale for what I'll talk to you about, and we can go from there. So basically, with people with diabetes, and as we get a little bit older, diabetes, you don't heal as well. That's just unfortunately the nature of the beast. Also, as we get older, we do not heal as well as if we do when we're 30. We also know that the more levels that we fuse, meaning we're talking about, I think you need a fusion at C4, 5, C5, 6, and C6, 7. With a 1-level fusion from the front only, the fusion rates are around 90%. A 3-level fusion, it honestly drops down to almost 70%. Just because the more levels we fuse, your body cannot just devote as much energy. With people with diabetes, it's actually probably worse than that. So what I would propose is we do part of the surgery in the front and part of the surgery in the back. The front, where we go in and we scrape out those degenerative discs and we replace them with these little spacers, which open up the disc spaces, take the bone from grinding, and also helps with the fusion. On the same day of surgery, we make an incision in the back where we put screws and rods in, get the pressure off of the spinal cord, and then help achieve fusion. What I do know is that by going in the front and the back, the fusion rates go from 70% to probably 95+%. Nothing's ever 100%, but very significant. The only downside of it, it's a little bit more surgery time, a couple hours of surgery, but it keeps you from coming back. If you were 30 years old and you didn't have diabetes, I would tell you to go in the front only. But honestly, with diabetes and being older, I would do both. Okay. Recovery-wise, the recovery is usually a 1 to 2 night stay in the hospital, up and walking right away. You wear a collar for about 6 weeks, which is honestly the biggest inconvenience. At 6 weeks, you start PT close to where you guys live. And then by 3 months, you should be rocking and rolling and doing everything you want to do. Will your neck pain will you be stiffer after fusion surgery? Maybe a little bit, but like watching you move, you don't move much because you hurt. What a lot of our patients say is they move better after fusion surgery because they don't hurt anymore, if that makes sense. Yeah. Risks, just a couple of things that we worry about with the risks. The risks of insignificant bleeding, way less than 1%, infection, less than 0.1%. Spinal cord injury, I mean, we are near the spinal cord. I mean, knock on wood, I've never seen it. Somewhere between 1 and 20 million. I mean, it's really, really rare. We use neuromonitoring here, so we keep you as safe as possible. So I think, you know, it's safe. Failure of the bone to fuse, pretty small. The level above wearing out, meaning the next one above wearing out, it looks pretty good, but theoretically in your lifetime, could the next one wear out to where you have something done? Maybe. Nothing you can do to prevent it either. If you sit on the couch or you live your life, you know, doesn't matter. You know, so at 3 months, we kind of turn you loose to doing everything you want to do.
Okay.
What questions do you guys have?
What sort of pain medication would
They give you?
Yeah.
We'll sort it out with our PAs. You know, we'll give you some Tylenol, we'll give you a muscle relaxer, and we use different things from tramadol to hydrocodone to oxycodone. It just kind of depends, kind of what works best for you.
Okay.
Yeah, we'll figure that part out.
Okay.
Okay.
All right.
Any other questions?
So he needs a therapy and.
Yeah, and that's at about 6 weeks. But by 3 months, you can do pretty much whatever you want to do again. And the goal is to get you back to doing the things you want to do. Yeah, you look like you're hurt.
Yeah, he is.
Okay, so I'm going to give you a little book that talks about spine surgery, and then Erin will come back in and talk to you. And then Bridget is my surgery scheduler, and she'll call you, and we'll get you set up
Okay.
and go from there. Okay?
All right.
Sir, pleasure.
Thank you.
Thank you so much. Nice to meet
Thank
you.
you.
Nice meeting you. Thank you. Nice meeting you. Good job. See ya. Thanks. Hold on one sec. Thanks, guys.
Thank you.